Hi, I'm Dr. Jennifer, your chiral medical provider, here to explain semaglutide. You've probably heard a lot about the weight loss drug called semaglutide. It's an effective prescription medication that belongs to the class of drugs called GLP-1 or glucagon, like peptide-1 receptor agonists. It works by stimulating the release of insulin from the pancreas. This inhibits the release of glucagon and slows down the emptying of the stomach to promote a feeling of fullness that can reduce the appetite. Semaglutide is the active ingredient in two prescription drugs that you may have heard of, Ozempic and Wegovy. Their formulations are different and they are not interchangeable. Ozempic is prescribed to treat type 2 diabetes, but it can also cause weight loss. Wegovy, on the other hand, is prescribed specifically for weight management. It contains a higher dose of semaglutide than Ozempic and is prescribed to adults and teens with a body mass index or BMI of 30 or greater. People with a BMI of 27 or more are also eligible if they have weight-related medical conditions, such as type 2 diabetes, high blood pressure, or high cholesterol. Semaglutide is not available as a generic drug because another company owns the patent. But pharmacies can compound semaglutide with carnitine, cyanocobalamin, or an equivalent to create a formulation that's a little more cost-effective while potentially boosting the effectiveness of the drug. Carnitine is an amino acid in all our cells that is a critical part of energy production. Cyanocobalamin is a form of vitamin B12 that is important for cellular growth and reproduction, as well as protein and tissue synthesis. Along with semaglutide, they can work as potent fat burners. Semaglutide can cause side effects such as nausea, vomiting, diarrhea, and constipation, but it's not for everyone. If you've had or have a family history of medullary thyroid cancer or multiple endocrine neoplasia syndrome type 2, men too, you should not take this medication. It should also be avoided by people with type 1 diabetes, anyone with a history of chronic pancreatitis or GI disease, people who've had bariatric surgery within the last 6 months, and those who are having current gallbladder problems. If you have had your gallbladder removed, you are okay unless you have had any of the other problems listed, but be sure to speak to your doctor about that. Please keep in mind if you're pregnant or nursing, this medication should be avoided. Semaglutide is administered as a subcutaneous injection once a week. There's a good chance you've never given yourself an injection, but we have a video that can guide you through the process once you get your medication. Your dosage will start low and your doctor will bump it up over a period of time, providing you respond well. It's extremely important that you follow doctor's instructions and do not take more than the prescribed dosage. Taking more will not speed up your weight loss, so please stick with what your doctor tells you. If you're considering semaglutide as a treatment option, it's important to talk to your healthcare provider about the risks and benefits before starting treatment. Semaglutide is not a standalone weight loss solution and is meant to be part of a lifestyle change that includes healthy diet and exercise. If you want to find out if semaglutide is an option for you, visit chiral.com and we'll guide you through a health assessment. As always, if you have any questions about this or any of our products, please reach out to your healthcare provider. Thanks for watching.